My name is Brent Gregg. I'm currently the interim chair of the department, assistant professor, and director of the UCA Stuttering Center. I began the center here in 2008, summer of 2008. And since then, our caseload has grown dramatically from one case of a kid who stuttered in the clinic to now we have about 15. And so over the course of 2.5 years, it really has grown and is starting to serve a need in the community. I was at UAMS right after I completed my PhD, I started at UAMS, and in 5 years there, I started the Arkansas Center for Stuttering Research and Treatment, and saw the same kind of growth there. And then came here in 2008 and really wanted to follow through and make sure that I was able to continue to serve those clients that I was able to see previously, and also serve a kind of a niche here in Conway, in Central Arkansas area. Stuttering is an area within speech-language pathology that's very difficult to treat, very difficult to diagnose, and has a lot of misconceptions. And so as a result, a lot of speech-language pathologists in the field are not completely confident in dealing with that specific disorder. Many never had a course in stuttering, many never had a case with which to practice in the clinic during their graduate work. So once they get out, we have a fairly large knowledge gap. And many of these kids who stutter are not receiving best practices. So my kind of rationale for building the center here was to be able to give our graduate clinicians a place to get their feet wet, start to desensitize them to working with kids and adults who stutter, the parent counseling aspects of it. Because of that, it starts to then grow exponentially once they get out, and it starts to fill that gap. So whereas before, a lot of kids and graduate clinicians may never have even seen a child who stutters in our clinic during their clinical practicum work, now all of our students are being able to see a kid who stutters. And so again, it may not be their favorite area with which to work, but they're getting that experience, and they're able to take that knowledge out into the field once they receive their master's degree. The neat thing about our program is that it's set up so that the graduate students take their coursework first, the first year and a half, and then the rest of their time here is spent in clinic. So we really set a good foundation, a good groundwork towards the academic, the theoretical aspects of therapy. So regardless of the disorder of the kids that are seen here in our speech-language hearing clinic, all of our students get a good foundation before they enter into the clinic. So for example, the students who are working in the Stuttering Center will have had either undergraduate or graduate course in fluency disorders or stuttering, so that therefore when they enter into the clinic, they're set and ready to go. They have the information, they know the theoretical breakdown, they know the therapy options for preschool, school age, and adults who stutter. And so again, it starts to feed into a very comprehensive training experience for these students.
I feel that it is a great program. It provides a great opportunity for us as student clinicians to work with fluency clients and to help them better communicate and make them feel more confident about their speech.
I play games while doing my fluency, and it's really fun.